As the weather cools and people spend more time indoors, respiratory viruses begin to make their rounds. This year, three infections are at the top of the list: COVID-19, influenza, and RSV. While most healthy people recover without complications, these viruses can cause serious illness for older adults, young children, and people with chronic lung conditions like asthma or COPD. COVID-19 is still around but changing. COVID is no longer the overwhelming threat it was a few years ago, but it hasn't disappeared. New variants continue to emerge, causing mostly mild illness in many people, but complications remain a concern for higher risk groups. Symptoms often overlap with flu and RSV, making it difficult to tell the difference without testing. The flu arrives every year, usually peaking in late fall and winter. For pulmonary patients, influenza can trigger flare ups, worsen breathing, and sometimes lead to pneumonia. Annual vaccination remains a helpful preventive tool, but quick diagnosis and treatment are equally important. Even though RSV is often thought of as a childhood illness, it can also be serious in older adults and those with underlying health problems. It tends to cause cough, congestion, wheezing, and fatigue, and like COVID and flu, symptoms can overlap. Because COVID, flu, and RSV can look so similar, knowing what you're dealing with makes a big difference. That's why our office offers rapid in-house PCR testing for all three viruses. With a single swab, we can quickly and accurately identify the cause of your symptoms, often the same day. This helps guide the right treatment, whether it's antivirals, supportive care, or monitoring for complications. Beyond testing, there are simple steps you can take to lower your exposure. First, wash your hands often and avoid touching your face. Next, improve ventilation indoors whenever possible. Always wear a mask in crowded places if you're at higher risk. If you're sick, please stay home to protect others. And as always, talk with your provider about recommended vaccines, flu, RSV, and COVID if you're eligible. COVID, flu, and RSV will be with us each year as part of the seasonal virus mix. The key is not to panic, but to be prepared. If you develop symptoms, don't guess, come in for testing. Our in-office PCR test takes the mystery out of what's making you sick, so you and your care team can act quickly. Breathe easier knowing you have answers, not uncertainty this respiratory season. If you would like to make an appointment with one of our providers to discuss any respiratory symptoms, we have 5 convenient locations in South Jersey and one in Maysville, Kentucky. Give our offices a call, or you can schedule your appointment online at medcorpsusa.com.